20 main classes of mental illness and their treatment. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing Channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. 20 main classes of mental illness and their treatment are discussed in this video. Now, let us start. What is mental illness? Mental illnesses are health conditions involving changes in emotion, thinking or behavior, or a combination of these. Mental illnesses are associated with distress and/or problems functioning in social, work or family activities. Mental illness is a general term for a group of illnesses that may include symptoms that can affect a person's thinking, perceptions, mood, or behavior. Mental illness can make it difficult for someone to cope with work, relationships, and other demands. The relationship between stress and mental illness is complex, but it is known that stress can worsen an episode of mental illness. Most people can manage their mental illness with medication, counseling, or both. Diagnosis of mental illness. Mental illness is nothing to be ashamed of. It is a medical problem, just like heart disease or diabetes. Mental illness is treatable. Most individuals with mental illness continue to function in their daily lives. To determine a diagnosis and check for related complications, the patient may have 1. A physical exam. The doctor will try to rule out physical problems that could cause your symptoms. 2. Lab tests. These may include, for example, a check of the patient's thyroid function or a screening for alcohol and drugs. 3. A psychological evaluation. A doctor or mental health professional talks to the patient about his/her symptoms, thoughts, feelings, and behavior patterns. The patient may be asked to fill out a questionnaire to help answer these questions. How to ascertain type of mental illness. Sometimes it is difficult to find out which mental illness may be causing your symptoms. But taking the time and effort to get an accurate diagnosis will help determine the appropriate treatment. The more information you have, the more you will be prepared to work with your mental health professional in understanding what your symptoms may represent. The defining symptoms for each mental illness are detailed in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. This manual is used by mental health professionals to diagnose mental conditions and by insurance companies to reimburse for treatment. 20 main classes of mental illness. Here are 20 main classes of mental illness. 1. Neurodevelopmental disorders. This class covers a wide range of problems that usually begin in infancy or childhood, often before the child begins grade school. Examples include autism spectrum disorder, attention deficit/hyperactivity disorder, ADHD, and learning disorders. 2. Schizophrenia spectrum and other psychotic disorders. Psychotic disorders cause detachment from reality, such as delusions, hallucinations, and disorganized thinking and speech. The most notable example is schizophrenia, although other classes of disorders can be associated with detachment from reality at times. 3. Bipolar and related disorders. This class includes disorders with alternating episodes of mania, periods of excessive activity, energy, and excitement, and depression. 4. Depressive disorders. These include disorders that affect how you feel emotionally, such as the level of sadness and happiness, and they can disrupt your ability to function. Examples include major depressive disorder and premenstrual dysphoric disorder. 5. Anxiety disorders. Anxiety is an emotion characterized by the anticipation of future danger or misfortune, along with excessive worrying. It can include behavior aimed at avoiding situations that cause anxiety. This class includes generalized anxiety disorder, panic disorder and phobias. 6. Obsessive-compulsive and related disorders. These disorders involve preoccupations or obsessions and repetitive thoughts and actions. Examples include obsessive-compulsive disorder, hoarding disorder and hair-pulling disorder, trichotillomania. 7. Trauma and stressor-related disorders. These are adjustment disorders in which a person has trouble coping during or after a stressful life event. Examples include post-traumatic stress disorder, PTSD, and acute stress disorder. 8. Dissociative disorders. These are disorders in which your sense of self is disrupted, such as dissociative identity disorder and dissociative amnesia. 9. Somatic symptom and related disorders. A person with one of these disorders may have physical symptoms that cause major emotional distress and problems functioning. There may or may not be another diagnosed medical condition associated with these symptoms, but the reaction to the symptoms is not normal. The disorders include somatic symptom disorder, illness anxiety disorder and factitious disorder. 10. Feeding and eating disorders. These disorders include disturbances related to eating that impact nutrition and health, such as anorexia nervosa and binge eating disorder. 11. Elimination disorders. These disorders relate to the inappropriate elimination of urine or stool by accident or on purpose. Bedwetting, enuresis, is an example. 12. Sleep-wake disorders. These are disorders of sleep severe enough to require clinical attention, such as insomnia, sleep apnea, and restless legs syndrome. 13. Sexual dysfunctions. These include disorders of sexual response, such as premature ejaculation and female orgasmic disorder. 14. Gender dysphoria. This refers to the distress that accompanies a person's stated desire to be another gender. 15. Disruptive, impulse control and conduct disorders. These disorders include problems with emotional and behavioral self-control, such as kleptomania or intermittent explosive disorder. 16. Substance-related and addictive disorders. These include problems associated with the excessive use of alcohol, caffeine, tobacco, and drugs. This class also includes gambling disorder. 17. Neurocognitive disorders. Neurocognitive disorders affect your ability to think and reason. These acquired, rather than developmental, cognitive problems include delirium, as well as neurocognitive disorders due to conditions or diseases such as traumatic brain injury or Alzheimer's disease. 18. Personality disorders. A personality disorder involves a lasting pattern of emotional instability and unhealthy behavior that causes problems in your life and relationships. Examples include borderline, antisocial and narcissistic personality disorders. 19. Paraphilic disorders. These disorders include sexual interest that causes personal distress or impairment or causes potential or actual harm to another person. Examples are sexual sadism disorder, voyeuristic disorder, and pedophilic disorder. 20. Other mental disorders. This class includes mental disorders that are due to other medical conditions or that do not meet the full criteria for one of the above disorders. Treatment of mental illness. Your treatment depends on the type of mental illness you have, its severity and what works best for you. In many cases, a combination of treatments works best. If a person has a mild mental illness with well-controlled symptoms, treatment from that primary care provider may be sufficient. However, a team approach is often appropriate to make sure all the psychiatric, medical, and social needs are met. This is especially important for severe mental illnesses, such as schizophrenia. The treatment team. The treatment team may include the patient, family or primary care doctor, nurse practitioner, physician assistant, psychiatrist, a medical doctor who diagnoses and treats mental illnesses, psychotherapist, such as a psychologist or a licensed counselor, pharmacist, social worker, and family members. Medications. Although psychiatric medications do not cure mental illness, they can often significantly improve symptoms. Psychiatric medications can also help make other treatments, such as psychotherapy, more effective. The best medications will depend on an individual situation and how the patient's body responds to the medication. Some of the most commonly used classes of prescription psychiatric medications include 1. Antidepressants. Antidepressants are used to treat depression, anxiety, and sometimes other conditions. They can help improve symptoms such as sadness, hopelessness, lack of energy, difficulty concentrating and lack of interest in activities. Antidepressants are not addictive and do not cause dependency. 2. Anti-anxiety medications. These drugs are used to treat anxiety disorders, such as generalized anxiety disorder or panic disorder. They may also help reduce agitation and insomnia. Long-term anti-anxiety drugs typically are antidepressants that also work for anxiety. Fast-acting anti-anxiety drugs help with short-term relief, but they also have the potential to cause dependency, so ideally, they would be used short-term. 3. Mood-stabilizing medications. Mood stabilizers are most commonly used to treat bipolar disorders, which involves alternating episodes of mania and depression. Sometimes mood stabilizers are used with antidepressants to treat depression. 4. Antipsychotic medications. Antipsychotic drugs are typically used to treat psychotic disorders, such as schizophrenia. Antipsychotic medications may also be used to treat bipolar disorders or used with antidepressants to treat depression. Psychotherapy. Psychotherapy, also called talk therapy, involves talking about your condition and related issues with a mental health professional. During psychotherapy, the patient will learn about his/her condition and the moods, feelings, thoughts, and behavior. With the insights and knowledge you gain, you can learn coping and stress management skills. There are many types of psychotherapy, each with its own approach to improving your mental well-being. Psychotherapy often can be successfully completed in a few months, but in some cases, long-term treatment may be needed. It can take place one-on-one, in a group or with family members. When choosing a therapist, you should feel comfortable and be confident that he or she can listen and hear what you have to say. Also, it is important that your therapist understands the life journey that has helped shape who you are and how you live in the world. Brain stimulation treatments. Brain stimulation treatments are sometimes used for depression and other mental health disorders. They are generally reserved for situations in which medications and psychotherapy have not worked. They include electroconvulsive therapy, repetitive transcranial magnetic stimulation, deep brain stimulation and vagus nerve stimulation. Make sure you understand all the risks and benefits of any recommended treatment. Hospital and residential treatment programs. Sometimes mental illness becomes so severe that you need care in a psychiatric hospital. This is generally recommended when you cannot care for yourself properly or when you are in immediate danger of harming yourself or someone else. Options include 24-hour inpatient care, partial or day hospitalization, or residential treatment, which offers a temporary supportive place to live. Another option may be intensive outpatient treatment. Substance misuse treatment. Problems with substance use commonly occur along with mental illness. Often it interferes with treatment and worsens mental illness. If you cannot stop using drugs or alcohol on your own, you need treatment. Talk to your doctor about treatment options. Participating in your own care. Working together, you and your primary care provider or mental health professional can decide which treatment may be best, depending on your symptoms and their severity, your personal preferences, medication side effects, and other factors. In some cases, a mental illness may be so severe that a doctor or loved one may need to guide your care until you are well enough to participate in decision-making. Conclusion. 20 main classes of mental illness and their treatment have been discussed in this video. Mental illness is a general term for a group of illnesses that may impact a person's thoughts, perceptions, feelings, and behaviors. Mental illness can affect working and personal relationships. Medication, counseling or both can help you to manage mental illness. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, then give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.